We are live.
All right. Hello there. Good afternoon. My name is Leah Snyder, and with me are fellow registered nurses Robert Groves, Chanel Durant, and Shraddha Lemichin. And today we're going to be talking about gun violence, the failure to renew the assault weapons ban, and the Dickey Amendment. So we're here today to hopefully gain some foreground in the fight against gun violence. Mass shootings have become a rather large and all too frequent issue in our country. As of 2015, there was a reported mass shooting every 12 and a half days. And just a side note, a mass shooting is clarified as being a killing of 4 or more people. This statistic has surely increased in recent years. Mass shootings have been on the rise since 2004. Gun violence has led to demands of change in our country. Federal laws are still weak since the last major federal law fighting gun violence by placing a ban on assault weapons expired in 2004. States are now beginning to make their own changes to tighten up on gun laws. Most firearm policies are made at the state level. However, guns can still cross state lines. What message is it sending when a neighboring state has weaker gun laws? There is great and obvious need for federal policy on gun laws that can be universally accepted to reduce widespread gun violence in America. So today we'd like to suggest some feasible changes to our gun violence laws that will easily pose positive changes to the safety of all Americans. The first policy we would like to address would be the Dickey Amendment. This amendment was passed by Congress in 1996. It states, and I quote, that none of the funds made available to the Center for Disease Control and Prevention may be used to advocate for or promote gun control. In 2012, this amendment was expanded to include the entire Department of Health and Human Services.
The second legislation is the Federal Assault Weapon Ban 1994, which is expired in 2004. Congress enacted as part of the Violent Crime Control and Law Enforcement Act of 1994. The Public Safety and Recreational Firearms Act, referred to as the Assault Weapon Ban, which established a 10-year prohibition on the manufacture, transfer, or possession of semi-automatic assault weapons, as defined by the Act, as well as large-capacity ammunition-fitting devices. The assault weapons ban expired on September 13, 2004. The 1994 Act made it unlawful for a person to manufacture, transfer, or possess a semi-automatic assault weapon. Weapons banned were identified either by specific make or model, including copies or duplicates thereof in any caliber, or by specific characteristics that slightly varied according to whether the weapon was a pistol, rifle, or a shotgun. Number of victims of mass shootings increased from 21.1 in 100,000 citizens during the ban to 65.7 in 100,000 citizens once the ban expired.
One can find a plethora of research conducted by the CDC on such issues as physical, emotional, and sexual abuse. There also exists research on bullying and gang membership violence. But gun violence research has not made the list of research priorities for this federal agency since the first historical mass school shooting in Colorado 20 years ago. Part of the problem may lie in the funding and how the limited funds of the agency are dispersed. From the March 2018 congressional spending bill, the CDC was allocated $3.6 million for all research projects. In June each year, a board of scientists meet to develop a list of research priorities for the next fiscal year starting in July. And they allocate those research monies by letting 4 grants of $900,000 each. For fiscal year 2019, the CDC selected the following research priorities: injuries from motor vehicle accidents, children and youth violence, opioid drug crisis, and traumatic brain injuries. So it can be surmised that the lack of gun violence research funding not only stems from the interpretation of the Dickey Amendment, but also from competing research interests. From 2000 to 2018, 12,509 people were killed by mass shootings, without regard to gender, age, ethnicity, education, or economic background. Since Colorado 1999, 500,000 U.S. civilians have been killed by guns, and roughly 1.5 million others have survived gunshot wounds.
Gun violence is a universal issue that has the potential to affect everyone and anyone. Gun violence can occur in domestic violence, accidental shootings, mass shootings, gang activity, but mass shootings are oftentimes the least predictable and affect the largest numbers of people.
Rajan, Branis, Hargarten, and Allegrant conclude that the only way gun violence research is going to gain ground is if specific funding is allocated towards it. It needs to become its own priority and not compete with other research interests. CDC-funded research into other violence issues has proven over the years that when research is adequately funded, smart people often find solutions not previously thought to be relevant. It is time to repeal the Dickey Amendment and allocate funding earmarked towards prevention of gun violence.
It's important next slide. It's important to move this change to decrease gun violence. If nothing is done, there will continue to be an upward slope of gun violence throughout this country. For the past 15 years, the United States has had 2 mass murders on average every year. There is no alternative to implementing these policies other than accept gun violence as part of the American way. In the United States, we have developed one of the world's worst statistics for mass shootings and gun-related deaths due to the influx of guns floating around and gun laws, or lack thereof, that allow people easy access to them. By lifting the Dickey Amendment and reinstating the assault weapon ban, the outcome will most likely be a reduction in mass shootings and gun control.
Repealing the Dickey Amendment and allocating a substantial level of financial support for research can only lead to positive outcomes. The pittances already allocated across all federal agencies on this issue has realized that background checks, when consistently enforced, decrease injuries from firearm use by ensuring only the most responsible adults have access to weapons. Positive social interactions curtail gun violence, and non-political interventions to increase the economic plight of some of the nation's poorest cities reduce gun violence. In addition, by repealing the Dickey Amendment, and there may be opportunities to educate patients and parents about gun safety.
These changes may also pave the way for changes in physician gag laws, allowing there to be conversation between clinician and patient about gun safety. Believe it or not, there are actually laws out there barring physicians from having conversations with their patient regarding gun safety, which is absolutely ludicrous when we are allowed to question patients on personal issues such as alcohol use and illicit drug use.
Per the American Psychological Association, there are no reliable profile characteristics which can act as predictors as who will use a gun to kill or injure others. The documented lack of disadvantages is evidence that the general public supports gun injury prevention strategies. It is time for nurses to lend their voices, and it's time for our legislators to use their lawmaking abilities to enact laws that will prevent gun violence and end these needless deaths. The Giffords Law Center to Prevent Gun Violence has attempted to measure the cost of gun violence down to the individual incident. using measurable costs such as healthcare, law enforcement, and criminal justice system expenses, insurance costs, and lost wages. It is estimated that each incident of homicide by gun costs $464,000, and each non-fatal injury costs $40,000. In 2017, Baltimore implemented a model program called Cure Violence. This is not a gun prevention program per se, but one which directly addresses the causes of violence in at-risk neighborhoods. Caseworkers mediate street conflicts before they become violently confrontational. Some Baltimore neighborhoods have gone an entire year now without a homicide recorded.
I think we can all agree that the cost of saving lives is priceless. The current restrictions on gun violence research makes it difficult to assess the efficacy of gun laws.
While the evidence shows efficacy measurements are dampened by lack of research monies, many communities such as Boston, Baltimore, and Minneapolis have funded community outreach programs to curb violence. Some of those strategies include hospital-based intervention programs dealing with personal and community safety, establishment of safe parks for youth to gather and play, efforts to increase youth employment, funding neighborhood economic development, and reducing the number of outlets where alcohol sales are available through conservative licensing laws.
There are many organizations which support against the gun violence. Among them, the listed ones are the most active organizations. Nurses across the nation see firsthand daily the physical and emotional aftermath of a gun violence. The American Nurses Association has raised its 4 million members' collective voices in a call for action for the Department of Health and Human Services to begin sustained and substantial research towards gun violence prevention. The Brady campaign works to pass and enforce federal and state gun laws, regulations, and public policies through grassroots activism, electing public officials who support gun control legislations, and increasing public awareness of gun violence. Nurses are on the front line of gun violence, and it does not only happen in the emergency room, but can also happen in any unit in the hospital in general. There are a total of 80,000 school nurses estimated in this country, and so is the epidemic of gun violence, which is also up and close and personal. Due to this fact, the National Association of School Nurses has joined with other professional nursing affiliation and organizations to fight and lobby against the gun violence. School nurses all across the nation has collaborated together to identify potential violence and intervene to diminish the effects of violence on both school, children as individual and population in schools and the community. GunFreeKids.org is an internet-based 501c issue advocacy organization which provides tools for people to take action on pending state and national legislation and assists voters nationwide in learning about and supporting state-based candidates who favor gun violence prevention policies.
Just to recap, repealing the Dickey Amendment would allow major funding agencies such as the CDC to do research regarding gun control, fire injury, and death-related gun violence. Research is important to implement evidence-based policies to control gun violence. Prior to the passing of the Dickey Amendment, CDC's budget was $2.6 million. Currently, they use about $100,000 to research firearms. So far, only 18 states have taken the initiative to actually require a background check on all gun sales. Federal law only requires background checks for gun buyers from licensed gun dealers only. According to Vernick, Alcorn, and Horowitz, more than 3/4 people incarcerated for crimes involving guns got their gun from someone that wasn't required to do a background check. We need to address gun violence from a prevention approach rather than just responding to violence after the fact. Reinstatement of the federal assault weapons ban would also just decrease mass shootings.
Gun violence touches every segment of our society. It increases the probability of deaths in incidents of domestic violence, raises the likelihood of fatalities by those who intend to injure others, and among those who attempt suicide, places children and young people at a special risk, and importantly affects communities of color. Debates on gun control continue to raise on all across the country, despite the impending debt ceiling and the government shutdown. 1 in 3 people in the US knows someone who has been shot. On average, 31 Americans are murdered with guns every day, and 151 are treated for a gun assault in an emergency room. Every day, on average, 55 people kill themselves with a firearm, and 46 people are shot or killed in an accident with a gun. The US firearm homicide rate is 20 times higher than combined rates of 22 countries that are our peers in wealth and populations. The Center for Disease Control and Prevention keeps track of the numbers of gun-related deaths in each state. So in conclusion, the human life is important, and therefore this legislation is important and needs to be lobbied and funded for it to be effectively save people's life against gun violence.